Hi, I'm talking about two things today. One is a description of asthma and viral induced wheeze. So, asthma is abnormal hyperreactivity of the airways. So, it can be triggered by a virus or it can be triggered by any allergen like pollen or house dust mite. And the airways in your lungs narrow down and it becomes difficult for children or adults to breathe out. Breathing in is okay, but breathing out is a problem, and uh, they struggle to breathe and you hear the sound. This is called a wheeze. So uh, they breathe fast to get the carbon dioxide out of the lungs, and there's increased effort of breathing, so you might see that as fast breathing, and there can be some tracheal tug, and sometimes the little ones can do what we call head bobbing. Treatment, there are two things. One is what we call salbutamol inhaler. So this is what we call a reliever. So this is to relieve the bronchoconstriction in the airways, and it's used by with a spacer in children. So what you do is you attach the spacer here, and then you have to shake it well so that the powder is nicely mixed. You press it and you take 5 or 6 breaths through this. Okay, if you take more, you have to shake it again. So this is to relieve the bronchoconstriction in the lungs and it becomes easier to breathe. So if you're needing this blue one, which is called salbutamol, quite a lot, then sometimes you might be put on what we call a preventer, which is usually brown. It's called beclomethasone, and it's a steroid inhaler. What it does is it basically reduces the inflammation and swelling caused by the allergen or the infection, and you may not need that much of salbutamol. So preventer, it's called preventer, and this is called a reliever, the salbutamol. So remember the difference. Now the preventer has to be taken regularly. So you'll be prescribed 1 or 2 puffs in the morning and evening, and again you shake it, put it in there, and take it after pressing it. Again, if you need more, you have to shake it again. Remember, with the steroid inhaler, you have to rinse your mouth after taking it, or do a mouthwash, because the powder inhaler, if it remains in your mouth, it can cause fungal infections. Now there are two types of spacers. This is an aero chamber for older children who can put their mouth around this. If they are smaller, then you use this one which has got a mask on it. So again, you shake it, put the inhaler here, and this is a baby I have. So you cover the mouth and the nose, press it. They will cry, they'll be unhappy, but they have to do it, and then let them be there for about 10 seconds. So that's how you deliver inhaler to babies and children.